And as an illustration of what happens when we take disruptive technologies that could enable new business models, but instead we plug them right back into an old business model, I'll describe to you the disruption of the consumer electronics world by the transistor. And there was an era where vacuum tubes dominated consumer electronics. You had devices like television sets and radio sets built out of a vacuum tube. And the leading companies of that era were companies like GE and Zenith, Westinghouse, RCA. And all these companies saw the transistor coming. They all licensed the technology, and they all spent hundreds of millions of dollars trying to figure out how can we make a television set or a radio set out of a transistor. And so that's the path they took. They tried to take this disruptive technology called the transistor and plug it into their existing technology and try to figure out a way to make a good enough television set that people who were buying vacuum tubes television sets would be willing to consider them. But that was a very high hurdle that they created. And despite all the money they spent, it was just so difficult to build a good enough television set immediately using a transistor. And instead, where the transistor first showed up was not in a television set or a radio set, but it was in a hearing aid. Now, a hearing aid was one of these perfect outer rings of non-consumers, people who couldn't access any technology because you couldn't build a hearing aid out of a vacuum tube. It would be just too big. And so it was really not a viable technology until the transistor became available. And so a transistor-based hearing aid, no matter how crummy it was infinitely better than nothing. And so for this set of customers, the hard of hearing who needed a hearing aid, it was a perfect technology, and they were very willing adopters. And of course, transistors, having first appeared in hearing aids and found that starting market, got better and better, and eventually transistors became powerful enough to run a pocket radio. Now, when the first pocket radio came out from Sony and Panasonic, these also had some drawbacks. Much like many of the other disruptive technologies we've seen, there were some trade-offs that were made. These portable radios were, tinny sounding, and you got virtually no reception. You had to keep it pointed to the same direction in the sky to get any kind of reception. And fortunately for the transistor, the makers of these pocket radios, folks like Sony, realized who their target customer was. And it wasn't the people who were buying these big tabletop radios made out of vacuum tubes, because you couldn't compete against that quality. Instead, Sony and Panasonic realized that their market was, again, one of these outer rings of non-consumers, these kind of the low end of society, people we call teenagers. And here, among teenagers, you found a very willing set of adopters, because once again, they were largely non-consumers of radio sets, because those radio sets on the tabletops were too expensive and could only be bought by their parents. And so teenagers were the first adopters of the pocket radios and accepted those trade-offs. And of course, over time, pocket radios got better and better. And before long, transistors showed up in portable television sets. And once again, there were trade-offs here, because the first portable television sets weren't very good. Certainly, if you stood them side by side with a floor-standing model built out of a vacuum tube, you couldn't compare. But they appealed to another ring of non-consumers. And these were the people who didn't have big enough wallets or big enough apartments for those big floor-standing models. And those ended up being the first adopters of the portable television set made out of these transistors. And then from there, of course, these TVs improved year after year and started to encroach on the territory of the vacuum tube market. And before long, those companies, RCA and GE, Zenith, and Westinghouse, were in big, big trouble. And so again, allowing these disruptive technologies that enable new business models to arise, it's very important for us to keep that in consideration, because it's impossible to have that expectation in healthcare for new technologies to all of a sudden replace what's already out there. But when we consider how they might be used to deliver care in a more affordable fashion to people who otherwise couldn't get care or would have to wait for long periods of time in order to get care, I think those are the opportunities for disruptive innovations to arise. And as I mentioned, it's when we make this mistake of plugging technologies into our old business model that's dominated by the centralized hospital that actually drives costs up rather than helping them fall. And things that continue to trap us in this era of a dominance by general hospitals are protective regulations, licensure and accreditation, payment and reimbursement policies, and a cultural resistance across the system. Now, just talking about regulations in general, it's not as though legislators set out to do this. Many of these regulations were set up to protect patients. You want your doctor to have an MD, the person treating you to have an MD, because it assured you that that person had sufficient qualifications and training. You want to make sure that you don't overbuild hospitals in your area, because otherwise you're spending too much on healthcare, and you want to keep that in check. And certainly you don't need 2 hospitals on the same block. So there were a lot of these ideas that made sense, and they were meant, again, to protect consumers. But in the end, over time, what they end up happening is the effect is they protect providers more than the patients. And so today, those same regulations are twisted, so that physicians will argue something like, any business model that tries to use a nurse practitioner to deliver even the most basic elements of care should not be allowed because they don't have that MD behind their name. Or you cannot build another healthcare delivery institution in my neighborhood because there's already a hospital here, even if that new institution is more effective and more efficient. So these regulations, even though they were well-intentioned when they were introduced, need to be reevaluated. Many of them end up, as I said, protecting providers more than patients. And in fact, it's not just about the fact that this hospital business model is the dominant business model in healthcare, but they are, in fact, this mixture, and I think I heard this earlier in one of the comments, they're really a mixture of very different business model types. And there's an article that was very helpful to us in understanding this, understanding what were the real root problems of the general hospital. And this was written by a Norwegian professor. And he said, basically, I can divide up the world into 3 different types of business models. And when we read his paper, we said, holy cow, one of the big problems that general hospitals are facing is because they started up over a century ago, they had eventually transformed into this entity that was being asked to do all things for all people. And as a result, they were trying to combine all of these different activities under one building that normally, in any other industry, we would house under 3 different business model types. And so just to walk you through this, to understand why hospitals have such a hard time managing their accounting and can never tell you the price of anything or the cost of anything, and why there are so many medical errors when you're trying to hand off from one division to another, or why there's very little communication across divisions. We'll apply this Norwegian business school professor's idea of business model typology to the general hospital.